I want to go into a topic that I've been talking about on the Nowman Show for quite some time. There's more updates, obviously, in 2020, especially now during the public health and safety crisis, pandemic, and that's healthcare. I've talked about Medicare for All. And I'll get into that. But before I do, a little bit of a historical background in the subject of single payer. On the campaign trail in 2007 to 2008, before he became president, Barack Obama, he campaigned all around the country telling us that we need a single payer healthcare program here in the United States. Well, not only did that not happen when he got elected president, he had to take what's called the public option completely off the table going forward. We ended up with Obamacare. More people could get covered than before, instead of the premise of getting everyone covered. And that's basically what Medicare for All would do. Now, the Barack Obama presidency turned into 2 terms. So taking even the public option off the table to go in that direction was because he accepted millions of dollars from big pharmaceutical and big insurance companies. So we didn't even have the option to go in the direction of Medicare for All. And when donors do a political campaign, something that's legal in the United States, give you millions of dollars, well, you tend to incorporate what they want, which is exactly what he did, because he also got a second term of 4 years. So, fast forward, as you know, it was part of Bernie Sanders' campaign in 2016 and 2020 when he campaigned for president. And here we are in 2020 with a public health and safety pandemic crisis. And we still don't have a healthcare system, healthcare for everyone. We have a combination of different organizations, businesses, for-profit models working together with the government. The government model basically is Medicare. The federal government, created during the LBJ administration in the 1960s. Very popular. And it's something that senior citizens have. There are various forms that people with low incomes get. Here in California, it's called Medi-Cal. You don't have to pay. There's no out-of-pocket expenses, deductibles, premiums, anything like that. It's not a for-profit model, right? No healthcare system anywhere in the world is going to be perfect, and I'll say that probably more than once in this segment, including a single-payer program, including the Medicare system that exists here in the United States. Single-payer basically means you have one administrator. You don't have these different organizations or companies working together kind of as a daisy chain, where you have maybe a specialist medical company that's for profit, and then you work with a non-profit somehow that's a medical service, or an HMO or PPO, where these are for-profit businesses. They're not providing health care because it's a human right. They're offering it to make a profit, like a cell phone or a refrigerator or a car. It's a crazy system. It doesn't cost less than a government-based system. It's not really any more efficient. I'll get to that in a minute here, even though some people will tell you that a for-profit model is more efficient. I talked to a person recently that came from what he called a democratic socialist country with a socialist healthcare system, and he was basically saying it's inferior to ours, and yet acknowledged that the for-profit model with all the money and the bureaucracy and the dysfunction, the administrative nightmare that it is, and the price tag that is outrageous for the average family. It's really a system for those who are financially more comfortable, or for the wealthy. And he talked about, in the country where he came from, about how there's no costs set up, no system set up for malpractice suits, or you have to wait a long time to get a certain procedure, or to see a doctor for this or that reason. And he did very quickly say at one point, and I didn't ask him to elaborate more, but very quickly, this is how he said it. Some countries are better than others. But he did say something like that. Some countries are better than others, and he said it fast like that. I heard it. I caught it. But he was basically, we were in agreement that no system is perfect, whether it's in a democratic socialist country, as he called it, or here in the United States. And of course, here in the United States, we also agreed that the costs are just absolutely outrageous and through the roof for those who can't afford some of these medical expenses, hospital bills and things like that. Bankrupts people. It's just an insane system when it comes to the cost. I will say that there are some incredible technologies here in the United States, like for instance the MRI machine. But if somebody says that we used to get easier access to an MRI machine here in the United States, well, yeah, that's because they're made in the United States, and it's their business model to give priority to American companies, and they can't just crank those out like you would crank out something small. These are complicated machines, and it takes time to get an inventory built, and probably as soon as you get inventory set up, it's all gone, because there's customers all over the world that want to buy it. So yes, countries who are not on the list, maybe they don't depending on where you are on the list, I guess a U.S. medical companies get priority. Of course, we're going to have more of those machines, so yes, we're going to have more access to that kind of care. But that doesn't necessarily mean our overall system is better, because it isn't. I mean, we're the only one of its kind in the world, and we're falling backwards in so many different ways, which the overall quality of the healthcare is one of those ways that we are falling back. And we have quality nurses and doctors and education, and as well as technology, but that doesn't mean that we're overall the best system. There's so many other different factors. Just like overseas, talking about people waiting in lines or waiting a long time to get procedures. Well, I find that that's true here in the United States a lot too. Maybe if you're more financially comfortable or wealthy, maybe that's not the case. You don't have to wait in line or wait as long. If you have more money to pay for it, it would make sense they would put you at the front of the line. And I've heard stories and seen some things myself, so there is some degree of truth to that. To deny that would not be a fair evaluation of comparing systems. A lot of people wait in line. A lot of people have to wait for appointments and procedures in this country. It's just in the United States. It's not a whole lot different in many ways than the socialized health systems of Europe in that way. So basically, Medicare is an already existing system for senior citizens, like there's Medi-Cal in California for people with low income. So this basic system already exists, that's administrated and through the government, and with government tax funds within the system. You and I pay taxes. The difference is Medicare for All literally is that. You take the Medicare system and you make that for everyone. That's what it is. So there have been polls, and not just the one as of April, after the quarantine was announced for the COVID-19. But in April, it's demonstrative of other similar polls, similar types of statistics. 88%, I believe it was a Harvard poll, because numerous sources have reported it. 88% of people registered Democrat favor it. 69 overall in the country, and up to 46% of Republicans favor Medicare for All. And yet, the establishment, nope, we're going to keep the system that we have, or at least we're going to keep the for-profit companies, the PPOs, the HMOs, other medical companies, pharmaceutical companies. We're going to keep them in the loop, and they'll be able to charge the prices that they wish to charge. or supposedly supply and demand in a supposed free market. But most people do not prefer that kind of a system. They prefer Medicare for All. So going forward, this is going to be continue to be a big story as things unfold, and as we all together should be coming together to find solutions, not to ignore what has been working around the world. Not perfect. Everybody who has healthcare for everyone is trying to make it better, but at least everyone is covered. The United States doesn't have everyone covered. That should always be the initial premise, and then you go from there to make it better. Medicare for All is the way system we already have. We could make that happen very quickly, and it wouldn't cost necessarily any more than what we're already paying for it. So I had to discuss this. It's important. It's time we move forward and get everyone health care, because it is a human right. It's part of the Universal Declaration of Human Rights, taken to the UN, and it was passed in the 1940s. And it was taken to the UN by former First Lady Eleanor Roosevelt. So, an American. So it can be done. Most countries, civilized countries around the world, have done it this way. They're in form of a single payer, one administrator system. We can do this. Someone pointed out to me the other day that maybe we're using the wrong kind of terminology when we talk about social distancing. It's really more like physical distancing because of public health and safety reasons. Social distancing really implies socializing, and that's something we shouldn't stop doing. We have to be practical and smart about how we do socialize, going beyond the internet, let's say. But physical distancing is really what this is about, right? Or standing 6 feet apart. That's more physical distancing than social distancing.